Welcome back. Are you a woman suffering from the symptoms of low thyroid, or think you might be and just not sure? Well, if so, then you don't want to miss the next few minutes. I'm very excited to have with me Communications Director of Integrated Health Center of the Rockies, Amanda Vargas. She has some new and exciting information for women who continue to suffer from the symptoms of low thyroid. I'm so glad you're here, Amanda.
Thanks so much for having me.
Yeah, absolutely. Okay, first of all, this is such a frustrating issue, and even going over my notes for this section today, I was looking at it and talking about people. Paint a picture, if you will, of what women are experiencing when they're having the low thyroid and having some of these complications.
Absolutely. So this really is a tragic story for these women. And as someone who has been involved with this condition for many years now, it's really shocking for me to see how many women are still needlessly suffering. So it starts with them experiencing a myriad of symptoms. So that could mean anything from weight gain, inability to lose weight, depression, fatigue. Their menstrual cycles will go haywire, or they even start losing their hair. So after a certain amount of time, they'll say to themselves, okay, this isn't normal. I should probably go get this checked out. So they'll go to the doctor. The doctor will run some blood work, and that blood work will come back indicative of a low thyroid condition. They'll get prescribed thyroid medications, and then they're sent along on their way. They go home, they feel validated, they feel good that they trusted their intuition, and they think they're on a path of health and happiness again.
Right.
So they go back to the doctor again a few months later, and the doctor will say, yes, we got it, after running the follow-up blood work. But then these women are frustrated, and they're looking at their doctors like they have two heads, because they feel the exact same way that they did at the first visit, or those symptoms have expanded and they feel even worse. So that's really where the frustration begins.
And that's why you're having these wonderful dinner events, so people can understand and learn some more. All you need to do, they're Tuesday, January 15th at 6 p.m. Space is limited, so you're going to want to call today to reserve your spot. It's so important. The number is right there on your screen to go ahead and RSVP. Now, when you share me these stories, I mean, the women that are suffering from this low thyroid, they're just frustrating symptoms. I mean, as you were saying, the weight gain, things like that. There is no one quick, easy answer when they go and talk to their doctor, right?
That's correct. And you know, we treat women of all ages and all shapes and sizes, of course, but I would say the most common age ranges that we see are women who are 30 to 40 who are new moms, as well as women who are 45 to 60. And you know, what's really interesting about the new mom group is that they tend to chalk up a lot of these symptoms to having just given birth.
Yeah,
so they think,
fatigue
yeah,
and everything.
Exactly.
Of course you have a little weight gain. You just had a baby.
And they think that it's just going to subside, when in reality it's not.
Right.
And same goes for our women who are 45 to 60.
Premenopausal and all that, right? Yeah.
Yeah. And they go to the doctor. Their doctor chalks all of this up to aging, or they need to exercise more and lose weight, or even worse, it's all in their head.
So when you go to get the lab results, they come back normal. I've actually had this happen where I've gone to and they've said, oh, the lab results are fine. That's not what you have. And you're thinking, oh, well, but they don't have any other answers for you, right?
Yeah.
So when you see all this, is it possible that the doctors are looking or maybe even trying to treat the wrong thing?
You know, not only is it possible, but it's highly likely that they're treating the wrong thing. And ultimately that boils down to a lack of thoroughness. And because of that lack of thoroughness, the #1 cause of low thyroid is often going untested, which means, I'm sure as you can imagine, it's not even being treated.
Yeah.
So that's extremely frustrating for us, because we know that this #1 cause is a very serious disease that can contribute to other serious health matters, as well as put these women at an increased risk of diabetes, lupus, MS, and even thyroid cancer. So I think what your audience should take away from this is that if they're still suffering from low thyroid, it's likely that the actual cause hasn't even been found yet.
Absolutely. Or they've just been giving excuses that just seem to relate to their everyday lives, you know, whether it be having babies or going through menopause or something as well. Folks, this is go ahead and attend this free thyroid dinner event. You really want to go ahead and RSVP for your tickets right now. It's January 29th at 6 p.m. and the seating is very limited. You see right there on your screen the number to call, which is 303-974-1087. Go ahead. It's January 29th, 6 p.m. Reserve your spot. So now that you're talking to women, you've sort of figured out a way that maybe you can help them. What kind of successes are you seeing?
You know, this piece is really exciting for me to talk about, because our doctors are extremely thorough on the front end. And you know, I've always been impressed about how they get to the root cause of the problem before ever beginning treatment. And I think that that's the secret to our success. You have to get to the real and the root cause of the problem in order to see symptomatic success in your patients. And I know that it sounds like a very basic principle, but unfortunately we see so many providers who are failing at this level. And I think that because we are able to get to the root cause, we're able to customize treatment programs to the individual. So no one's getting any cookie cutter or one-size-fits-all treatment program. Everyone is different.
Well, we're so glad you're here to let everyone know about it. Let's go ahead and give you, again, more details here. Sign up to attend a free thyroid dinner. That event is Tuesday, January 29th at 6 p.m. As I've said before, seating is very limited, so go ahead and reserve your space now by calling 303-974-1087. That number again is 303-974-1087. Integrated Health Center of the Rockies, paid for the segment.